sounds really good.
Awesome.
And go ahead whenever you're ready.
Hi, I'm Dr. Bishara. I'm a plastic surgeon and a hair restoration surgeon here in the North Texas area. I wanted to just take a moment in this video consult to be able to let people know what to expect from a robotic procedure. We get a lot of questions about game day and how things kind of go down. And I think it's helpful to just kind of capture, just in a few minutes, what to expect from your robotic procedure, at least in our practice. Okay, most of the time when patients have come in for a consult, we already know what we're doing and what we're treating on that game day. Typically, we're doing somewhere around a small hair transplant, a medium hair transplant, or a large hair transplant. And all those are associated with a certain number of grafts. But regardless of the size of the procedure, most patients will arrive very early in the morning. We like to start our days very early, and it allows us to handle the load that we have. We have multiple procedures that are done in a single day, and for that reason, we like to get started early. Okay, so a typical start time might be for a patient that they come into our office. They're usually arriving around 5 o'clock, 6 o'clock in the morning. They will come in and be greeted by one of our staff members with a clipboard that has a series of some consent forms. Those consent forms just go over the risks and the benefits of hair loss procedures, and particularly about our procedure that involves a robotic arm. Then they'll go into one of our operating rooms where their clothes are changed out for a gown. Their hair is trimmed and photographs are taken. They will also be subject to phlebotomy, where we're taking some blood. We're going to take some blood out of the arm, and we're going to put that into the centrifuge, and we'll put it aside for later use. We'll take your vital signs. Your blood pressure and your heart rate are extremely important to us, along with your weight. Then we will administer a slight amount of anxiolytic by mouth. We will give you some antibiotics to prophylax you for the day. And we're going to give you a shot of prednisolone, which is a steroid, to really help prevent the swelling. Another thing that we like to do also is when we're trimming the hair, we like to trim the donor area so that the robot has good access and a good idea when it's scanning the back of the head, and it knows how to calculate the angle of approach. So we have to get the right length of your hair. Then we will establish a block. The block is something that we use to administer anesthesia along the sort of the ring of the head. That way, when we're working above that ring, you can't feel anything, right? So these are tiny little Botox needles. And when we're doing our Botox injections on a specific day of the week, we're doing 30 to 40, 60 to 70-year-old ladies, and they keep coming back by 2 and 3 at a time. So we know that if they can tolerate that, so can you. So we'll administer a block of local anesthetics along with a little bit of what's called tumescent anesthesia. And then behind that block, we'll take the platelet-rich plasma mixed with something that we call Plasma-Lite A. It's just an isotonic solution that helps us deliver a larger volume of those growth factors to a larger surface area. Also, we will administer a small amount of steroid into the recipient area to help prevent ongoing perioperative erythema, which is redness that can kind of plague that recipient site for weeks after the procedure. Then I will make all of the sites in the recipient area that are typically in the anterior portion or in the front of your scalp, the hairline, all of that's done at the beginning. Then we'll put you into the robot. Okay, and the robot will produce all of the dissection that we do for the procedure in the back of the head and on the sides. Okay, and that's determined by some things that I'll do at the robotic console. While you're in the robot, if we're doing any type of crown work where we're going to be transplanting in the crown, I'll make your sites while you're in the actual robot. So it's dissecting, and we're making recipient sites where those grafts will subsequently be placed later on in the procedure. Then you'll get up when the dissection is done. We're going to put you back into a chair, give you a remote control to watch Netflix or to kind of surf the web. You can do either. And we're going to end up manually planting you. So It's important that folks understand that the way that the day goes is it's divided up amongst a team, right? That team consists of sometimes 3 to 4 surgical assistants, a robot, and myself. Thank you for tuning in to this portion of the day of the procedure, and we look forward to helping educate you and helping you on your journey towards treating your hair loss. Thank you.